This is Dr. Jerome Fryer, chiropractor. I wanted to share a few concepts with you regarding spinal stability and pain generators and helping reduce your symptoms so you can build a stronger back. So we're learning more and more about the causes of back pain. And one of the things that can be very helpful is maintaining and stiffening and tightening and adapting your own lower back. Let me explain a little bit more. We're starting to reveal the science. And what we're seeing more and more, now this is a Lumbo pelvic model that I've created to help with the education of back pain and helping patients understand clearly about what they need to do, the movements they need to do to reduce their pain. And it's working. And so I'm excited to be creating these models to help people understand. So to give you a better idea, what we're learning is that each lumbar disc, each motion segment, this is an L3, L4, L5, and pelvic model, and this is dynamic in nature. And what we're learning is that when movements occur more compared to the adjacent level, we call this hypermobility, instability perhaps, but there are these micro movements, these movements that occur that are in excess to the one beside it. Each segment needs to move in a certain amount. We call this stiffness. So there's appropriate stiffness that needs to be at each level. When one, for example, in this model here, moves too much, then what happens, there are these shear forces, okay? You see this? So there's shear movement, these micro movements. So when you go to bend, this one has a certain amount of movement, this one has a little bit in excess movement, and this one has normal movement. So there are these buckling movements, these movements where there are this constant shear stress. So think of it like this. When you go to bend forward, this one moves a certain amount, but this one, it moves too quick. It kind of goes, and when it moves too much, then it creates pain in these particular locations. It could be facet joint, it could be the disc. So these movements are critical in sharing. You want to share the movement through here. And sometimes it's very difficult to try and get this thing to move less. So one of the strategies that you can do is, and in the spirit of the NHL playoffs, I've got a hockey stick here. And one strategy you can use to help teach you how to move appropriately is you take a hockey stick, or you take a broom pole and you place it on your back, okay, just like this, okay? And when you bend forward, okay, I talked about in a previous video about hip hinging. So you want to hinge through the hips, not through your spine, okay? So when you go to bend forward, you want to use this posture when you go to grab things out of the bottom shelf, for example, when you go to take out the garbage, when you put the dishes away in the dishwasher, taking them out. So when you bend, and in particular, if you notice a bit of a pain trigger when you do these activities, there's something that you're doing repetitively that's causing the pain. You want to stop that movement to help it solidify and stiffen. I'll explain to you in a moment here. But when you bend forward, you want to make sure that your buttock and your mid-back remain in contact, as opposed to when you bend forward, you see how that lifts a little bit? You want to maintain that posture. You want to maintain that neutral posture. So when you bend forward, you're not creating these micro and excessive movements at that one particular location. Think of it like a fracture. What does the doctor do in order to heal a fracture? They cast it, right? Because casting this allows the tissues to stiffen and to tighten. Bone remodels, and then it's actually even stronger than it was before. And it's similar to the lumbar spine. The problem with this chronic low back pain is we keep making these wrong movements to prevent the body to be able to heal itself. Think of it like a temporary cast of the bone. Allow it to tighten and stiffen, and then there's more balanced motion between each segment. These things will adapt, but you got to give it an opportunity. So remember, bend with the lumbar spine in neutral. If you're having movements that are sore when you go to bend forward, learn to move the right way to allow your body to adapt efficiently. Thank you.